It should really go without saying, but UNM health system leaders are pleading with people to not assault the hospital staff.
It's a problem in hospitals across the country, but now some are raising the alarm on an increase in workplace violence.
Yep, Brianna Wilson sat down with the chief nursing officer at Sandoval Regional Medical Center in Rio Rancho to talk about the troubling trends she has seen in recent years now.
Pamela Demarest started her nursing career in 1974. She said it wasn't long before she had her first physical encounter with an aggressive patient at just 18 years old.
I was punched in the face and my arm was grabbed and twisted. And these are patients who have dementia. So at the time, I thought it's pretty normal.
These days, violence continues. Demarest, the chief operating and nursing officer at UNM Sandoval Regional Medical Center, says abuse spiked during the pandemic when people refused to wear masks and tempers ran high. Eventually, they died down.
We've had people who've had their arms broken, strains to their wrists, are not able to work because of some of the injuries that they've had, even as a trauma nurse. Many years ago. I don't remember the type of escalation that we're seeing here at healthcare. We even have people who are verbally or physically abused at the entrance.
Now, UNM health officials say violence is spiking again due to higher patient volumes and longer wait times for care.
There are times where people are, yelling and using profanity. That is considered workplace violence. We've been dealing with a pandemic with decreased amount of workforce and increased amount of patients for about 3 years.
Demarest says it's important for patients to practice patience.
I think if people would practice more grace and really think about how their words and actions affect other human beings, we're all struggling here.
In Rio Rancho, Brianna Wilson, KOB4.
The UNM health system wants to make very clear what behavior is acceptable in its facilities and what is not. So coming up in our next half hour, that chief nursing officer for SRMC explains how they're cracking down on that workplace violence.
I think if people would practice more grace and really think about how their words and actions affect other human beings, we're all struggling here.
Isn't that the truth? And the folks at UNM Sandoval Regional Medical Center are not standing for this.
Brianna Wilson explains their new plan to protect staff.
We have a lot of difficulty recruiting nurses. I know of a lot of nurses who have retired.
Pamela Demarest, the chief operating and nursing officer for UNM Sandoval Regional Medical Center, says increased violence in hospitals is driving away healthcare workers in an already understaffed field.
Last year for our hospital, we had 359 what we call behavioral incidents, which means that it can range anywhere from that verbal assault to physical violence.
Of those 359 incidents, 34 were considered violence against a healthcare worker.
Because family members are also becoming increasingly more aggressive toward people who are caring for their loved ones.
To keep the violence under control, Demarest says security officers with UNM Health System undergo critical incident training and de-escalation training with the Albuquerque Police Department. They also have to take a class called Managing of Aggressive Behavior, or MOAB.
All the nurses and staff in the emergency department also take MOAB training.
So when a patient or visitor becomes aggressive, a simple code or panic button will set those with training into action. Additionally, UNMH took a page from the book of multiple hospitals across the country dealing with similar increases in abuse, sending a clear message to everyone who walks through those front doors. These signs are the first thing you see at the entrance of UNM Sandoval Regional Medical Center.
4th floor.
There are several others posted on every floor stating that aggressive behavior is not tolerated and provides multiple examples.
Just the knowledge for the frontline staff members that we have a zero tolerance has really made a difference to most people working here.
In Rio Rancho, Brianna Wilson, KOB4.